Bienvenue sur ma plateforme, je suis nouveau trainee. Mon propos est de répondre à cette question. Notre corps médical était-il à la hauteur? Welcome to my channel. My purpose is to answer this question. Was our medical team up to the task? Écoutons deux d'entre eux. Let's listen to two of them.
The weekly time scale, what we see is that we had been noticing reasonable declines from week 24 to week 25, 25%, from week 25 to week 26, 26%. We noticed that we plateaued between week 26 and week 27. In fact, there was a 1.6% increase, just about. We consider that almost the same. And preliminary data coming back from the lab for today would conclude this week about 5% or so above last week. So again, a flattening, signaling the possibility that the downward trend is plateauing, and we need to look at that. We need to observe with caution the trend that we are seeing manifesting itself.
Exactly.
Looking at this again at that monthly time scale, we see the overall general decline from one month to the next, from May to June to July. And looking at the age and sex distribution of the cases, you see that it has maintained itself at basically 50-50 over the last 3 weeks or so, male to female proportions, and that 25 to 49-year-old age group still holding the majority, although at this point it's a slim majority. Looking at the age-sex distribution among those fatalities, we see that, as we've been noting, the above 60 hold about 65 or more % of the total deaths. We do have a reasonable number of deaths, a significant number in the under 50 age group, so that we don't want anyone under 60 rather, to think that they're exempt from risk. And also to remind everyone that the individuals here, for the most part, more than 80% of them did have some pre-existing comorbidity. So the risk in those with comorbidities is something that we wanted to try to mitigate. And one of those mitigation steps is, again, that vaccination that we want to encourage everyone to take up as it becomes available. Looking quickly at how we've been going, projections and performance-wise, that gray line, which may or may not be easily visible on this graph, is basically the projected number of cases that we expected to see had we continued along the path on which we were going between June 3rd and June 17th. So far, we've seen that more or less we have continued along that same path. The slowing hasn't continued to accelerate. So we've been basically holding pace, more or less. Haven't slowed any more quickly than we were doing before, but haven't turned around either. So again, we're looking at potentially some plateauing, but we're continuing to observe the trend as data continues to come in. I'm going to turn you over to Dr. Richards for the health system update.
I think we have a slight increase.
Good afternoon to the Honourable Prime Minister, the Honourable Ministers of Health, National Security, Energy, and the Office of the Prime Minister. This afternoon, I would like to present an update. Of course, good afternoon to the medical team, members of the media, and members of the viewing and listening population of Trinidad and Tobago. This afternoon, I would like to present an update on the status of the hospitals in the parallel healthcare system. As of July 17, 2021, there are 16 institutions consisting of 9 hospitals and 7 step-down facilities with a total capacity of 1,022 beds. The information provided is as of 8 a.m. on July 17, 2021. As Dr. Hines indicated, the rolling average, which is the average number of positive cases over the last 7 days, continues to decrease. There's been a sort of plateauing, and this is a good sign because the rolling average allows us to estimate how many hospital beds and how many patients would require care over a 3 to 5 day period. The orange and green lines demonstrate admissions and discharges in the parallel healthcare system. And on or about from the 28th of June, you would notice that the gap between the admissions and discharges continues to be narrow. Again, this is a positive sign because it demonstrates that there are not much additional patients being added to the parallel healthcare system on a daily basis, and so there is the capacity to treat patients requiring care. If we look at a breakdown of the admissions and discharges, we would notice that the number of admissions over the last week remained on or above constant. However, the number of discharges decreased between week 27 and week 28. It is important to note that the admissions and discharge of patients is really dependent on how ill the patients are, and that is the clinical severity. So it would indicate that over the last week we had more ill patients as compared to the last week, resulting in them being kept in hospitals for a longer period and being discharged later. This would really be evident when we look at the increase of 29 patients over the last week, and over the last week the parallel healthcare system had 78 additional patients. This is an important graph because it shows the actual number of patients in the parallel healthcare system. And we would note that as of 8 a.m. this morning, there were 385 persons across the 16 facilities. 296 of these persons were in the 9 hospitals in the parallel healthcare system, with 89 across the 7 step-down facilities. Similar to last week and the trends that we've been noticing over the past month, we would notice that there are 3 times as many critically and severely ill patients as opposed to recovering patients, really emphasizing the severity of the COVID-19 virus. The occupancy, of course, refers to the capacity of the system to manage patients, and there's been a consistent decline, however very slow, since May 28th or so, and today the occupancy stands at 37%. If we divided the occupancy by country, the occupancy in Trinidad and Tobago is currently at 39%, and it reflects a similar trend with the overall occupancy, while in Tobago the occupancy today is 26%. That means 4 out of 10 beds in Trinidad and Tobago are currently occupied, with 3 out of 10 beds in Tobago. We also look at how filled or the occupancy levels at the 7 hospitals in Trinidad and Tobago that treat the severely and critically ill patients. And you would notice that from week 27 to week 28, that is over the last 3 weeks, the only one hospital, which is the Augustus Long Hospital, has been consistently over the 75% or critical threshold. However, one would also notice that the actual percentages are slowly decreasing. That is the orange bar. It is important to note that in the step-down facilities, all 7 facilities continue to be under 75%, and that has been a trend again over the last 3 weeks. If we broke up according to level of care, we would notice that the ward occupancy, where the majority of patients receive care, is decreasing again from the May 28 period and is currently at 37% overall. However, the ICU percentages of occupancies as of today are 72%, and the high dependency unit is at 41%. It is important again here to note that the ICU intensive care and HDU care, where we care for the most severely ill patients, continues to be high. So we still have persons who are very ill in the parallel healthcare system. The parallel healthcare system was also developed to protect the traditional healthcare system, and from the beginning of July to present, we have noticed that the number of persons in the accident and emergencies in the traditional healthcare system continues to be low. As of this morning, there were 2 patients across the ERHA sites. There were 4 across 2 NWRHA sites, 3 across 4 SWRHA sites, and 9 across 3 NCRHA sites. The ambulance service system continues to show a decline, again very slowly, within the last 24 hours, 25% of transports overall were due to COVID-19. The turnaround time continues to be somewhere around 130 minutes from the time the patient calls to the ambulance being ready for the next patient. So thank you very much, ladies and gentlemen. I would like to urge you to practice the 3 W's and to please obtain your vaccine, because this is an additional layer of protection against being admitted into the parallel healthcare system and developing complications. I now hand you over.
Je suis convaincu et satisfait. Et vous? I'm convinced and satisfied. And you?